forward to this computer. Okay, so we are live on the recording, live on Facebook. Let's see if I.
Right.
All right, so choose I want to post a video. Okay. The blue line's moving. That's good.
Make sure you put in a title a couple times.
It's a no fetching video stream. Okay, I think we're good.
Right.
All right, we are. Let me just make sure I have the Facebook volume down so we don't talk over, because that's a delay.
Oh yeah.
All right, so let's actually just answer one someone asking in the group, and I'll just let them know it's on. All right, so I guess we can get formally started.
Yeah.
All right, so thank you everyone for joining us today. So my guest today, or our guest, is Dr. Stephanie Mundt from Scottsdale. It's very nice of her to join us, common folk down here in Tucson.
That's how Sun Devils look at you. No.
But yeah, Steph is, she has a very unique perspective on running, having been through some very unique experiences, and now being a physical therapist. So I'll get out of the way and let her introduce herself now.
All right. Thanks for having me to the best running group in the world here. So again, my name's Stephanie. I'm a physical therapist and running coach now, based out of Scottsdale, but I'm from Iowa originally. Do you want me to just kind of dive into my running history briefly?
Yeah, like just to kind of where you started and kind of take us through high school, and we can circle back and get to some of the details afterward.
Okay. So I probably started running with my parents around age 9 or 10. They liked to jog for exercise. So started running with them, and then joined the cross country team in middle school. And then started being fairly successful through high school. Freshman and sophomore year were actually was pretty good freshman and sophomore year. And then my junior year was my best year, and was injured my senior year. But those first few years, it was pretty clear that distance was going to be my thing. I ended up winning 3 state championships, all in track, none in cross country, but I was always in the top 7 in the state in cross country. Then I went from high school. I was recruited by a few schools, ended up choosing Arizona State University, and went there to run track and cross country, and didn't really quite turn out how I'd expected. I was pretty injury ridden that entire time, but it did get me exposed to physical therapy. I kind of had to do that on my own. There was, just based on the injuries that I had, it was a lot of like rest for 6 to 8 weeks and come back and try running again. And it was just kind of this up and down, this roller coaster. So after, I actually ended up quitting before my senior year. I was pretty frustrated with the whole process and got to kind of just do the regular college thing for a year. But I just still couldn't stop running, So I started training on my own, still got injured, and then had a little bit more serious injury about a year and a half ago, which has been one of the biggest kind of game changers in the way that I treat, and really in the transition from working for someone else to starting my own business. And now I'm back to running, or I was until April, another stress fracture in April. But goals now are to qualify for the 2024 marathon trials. So it was kind of in this process of being a very elite high school runner, hoping for that to happen in college, but just not really getting the chance. And then taking a little bit of time away just to run for fun, and then coming back to trying to run at a more competitive level. So the main theme throughout all of it is that I just keep coming back regardless of the recurrent injuries. So I get the hardships of being injured, but the highs that you get from running, that really weigh them out or balance them out. I actually ended up quitting before think I hear that.
You still there?
Yes.
Okay. Yeah. Sorry. It was just.
Kind of hear the echo. So yeah, no worries.
Yeah.
I think I can't hear it anymore though. So.
Okay. Yeah. I was just playing with the live thing to get everything dialed in. But yeah, sorry. So go ahead.
Yeah, I think that just I was just emphasizing kind of there's a reason that a lot of us keep coming back. And I think people who don't run just are like, why don't you find something else? Why don't you find a new hobby? And I just couldn't take that for an answer. And I don't really expect other people to either. Obviously if it's something that is an injury that we need to take time off, then we need to take time off. But people are just like, our bodies are so amazing that if we want to do something and we put our mind to it and we have the right help, oftentimes we can. I think where we struggle is more getting shut down by people who haven't seen someone do it like that, or they have these specific rules and take this kind of pragmatic approach, like, oh no, you don't have enough dorsiflexion, you can't run, or something like that. That people actually put limitations on other people based on things that we think we know to be true, but may not necessarily be true. So that's just been a big driver in starting my own business and figuring out how to be a physical therapist as well as a run coach. And with the goal of helping people overcome injuries and continue running for life and actually feel like they're strong and robust and resilient, and not necessarily completely avoid injury and completely avoid pain, because that's not really a realistic goal. I don't think, if you're pushing yourself really close to the edge, but to guide people through those ups and downs, and so they have someone to troubleshoot with and bounce ideas off of, and just feel like they're supported in their quest to either be the best or just continue to do what they love.
So with a stress fracture, stress reaction, so how many in total was it?
I've had 11. This was my 11th one. Yeah.
Wow. So with that being an injury where it's not something that you can like run through necessarily, or it's not like, oh, my Achilles is a little stiff today, so let's see how it goes these next couple of days. I mean, it's once it happens, like you're out for however. I mean, what is that like, number one, and what's it like going through that repeatedly?
The first one, I don't think I was able to really take seriously. It was in my foot. So it seemed like less of a big deal than, for some reason, like the femur, the bigger bones always seemed like worse. When it was in my foot, it was kind of like, oh, I just put a boot on and it'll be fine. Mm-hmm. And I was able to actually swim basically through that one. So I still finished my cross country season. I just swam for all my practices and then ran at races, which was not smart looking back. I wouldn't advocate that one for anyone going through the same thing. But you're right, with bone stress injuries, we absolutely do not want to run through them. That puts you at risk for a full fracture. And as a side note, which you probably heard in the podcast with Kristen, I also had orthorexia/anorexia. So I had some disordered eating and excessive exercise. So that actually lowered my bone density, made me much more susceptible to stress fractures. So in my case, it's not just that, like, oh, it's bad luck. Like, there's actually a reason that that bone stress injuries are my main form of injury. Mm-hmm. But it's very damaging. I think the second one I got, which was the spring of my senior year, was much more difficult because it completely ended my high school career. Mm-hmm. And at that point in time, that was the most important thing in the world, mm-hmm. And that's where it really came to light, because that was also a femoral shaft stress fracture. So that was a bigger bone. So that's where it really came to light that, like, it wasn't just like, this was actually an issue. So the eating disorder habits needed to change. It was, I had a doctor tell me that this was going to keep happening if I didn't make changes and that kind of thing. And so then I did start to make changes, but subsequently every time that it happened, it was just a little bit harder, because I knew not necessarily like the part about being out 8 to 12 weeks for the bigger bones wasn't as bad as thinking, now I'm never going to get my fitness back. Now, am I ever going to be as fast as I was? And more of that fear of losing out on my college hopes and dreams.
And so for your senior, just to kind of give this full perspective for your senior year, I mean, you were looking at, championships. This wasn't just parading around and just participating. Like, you had some significant stuff on the line.
Yeah, absolutely. I'd already committed to Arizona State. I was really worried about how they would take it, because I even on my recruiting trip a few months before, I had a stress fracture then, and so it was like, now I have to have this conversation of going into college. I've already had 2 stress fractures. What is that going to mean for my scholarship, for my future? And then every subsequent one, it was just more and more draining, because it was like, this is happening again. Am I gonna lose it? And they were very supportive and kind. It was definitely a good school for me to be at, in the sense that they didn't necessarily fault me for getting injured. They didn't take anything away. I still had team support, but because I wasn't able to practice with anyone, it didn't really feel like I was part of the team. But that had more to do with me not gaining enough weight for the doctors to clear me to run, than it did with the coaches.
Mm-hmm. Now, can you let's step back a moment and talk about orthorexia, because I think a lot of people don't really know that term.
Definitely. So orthorexia is more associated with the desire, the obsession with being healthy. And what comes along with that is typically food restriction and over exercise, with the goal being to run faster, to lift heavier, to perform better in your sport, not necessarily with the goal of being thin, and looking a certain way. And there may be, a certain component of that. There's a fine line, right, between disordered eating and just wanting to perform. But when it becomes something that interferes with your social activities, like I wouldn't, eat with the team, I would eat separately. If, it's something that you pretty much think about all the time, and it's changing your quality of life, like skipping social events to go exercise, or constantly worrying about what you're going to eat because you didn't get your second workout in, that kind of thing, that's when it becomes more of an issue. But the labels can be damaging, I think, more so because we put stigma on those with disordered eating, particularly anorexia, or bulimia. And so if you're labeled as that, yet you're still performing at a high level, well, let me backtrack a little bit. If you're labeled as that, one, it can be damaging and it can become like an excuse for your behavior. Whereas if you're still performing at a high level, even if you've got these behaviors that may be questionable, people think that you're just like very strong-willed and, they want to be like you. But I think we see a lot more athletes on that orthorexia side, and it can still be very damaging. It can be in that low energy state. But it's not caught as much because they're not actually desiring to be looking a certain way or thinking that they're fat necessarily. It's more for performance.
And one of the things that was tough for you, if I understand correctly, was that as you kind of went deeper down that rabbit hole of orthorexia, you weren't getting, at least in the short term, weren't getting unhealthier. You were actually going faster. So it was kind of this feedback loop.
Absolutely. Yeah. You start to perform better and it feels like you're doing the right thing until you hit the brick wall. And for me, that was that first stress fracture. So I ran one of the fastest times in the country in the 3000, my junior year, spring of my junior year, when I was like in the thick of it, but it had just been starting, and then got my first stress fracture about 6 months later.
Now, when you were doing these extra clandestine workouts, were they was it cross training, or were you just adding more run miles?
I was adding more run miles.
Mm-hmm.
Yeah, just on my own. I couldn't tell you, it wasn't like structured workouts necessarily. Actually, that's not true. I would also jump rope. I remember jump roping in my garage in Iowa, and like 30 degrees outside would be in my garage jump roping.
Uh-huh.
So it was all like cardio based, though. I had no concept of strength training at that point in my life.
And so when did this strength training come along for you?
It's funny. You'd think it would be during college,
Right.
but at Arizona State, the strength and conditioning guys were not really for cross country and track,
Mhm.
right? I remember doing bicep curls as part of one of our workouts. Like, what? What was the point of that? So I don't think it really became a part of my life until post college, when I was kind of tired of running and decided like I wanted to stay active. I need to do something else. And I started lifting pretty heavy and then just running kind of casually on the side. And that's actually when I ran some of my fastest post collegiate races. When I ran like a 54, 51, 15K, ran a 121 half. That was during a time when I was lifting really heavy 3 times a week and only running 25 to 30 miles a week, very unstructured. So I've tried to incorporate it still. I mean, with COVID, it's been very difficult
Yeah,
the past
yeah.
few months, but I've tried to incorporate heavy squats and deadlifts now, with all my training and with my athletes too.
So basically, you kind of came to the strength and cross training side really as kind of its own thing, and it wasn't until later that you started to put the pieces together as a way to kind of enhance the run side.
Yeah, absolutely. And I think it took having someone focused on teaching me how to lift too. Because it can be very intimidating going into the gym as a female, especially just like not really knowing what you're doing. And, in the past, I had been taught how to do bicep curls and step ups. That wasn't
Mhm.
super helpful. So having someone guide you through that, and then reading, in PT school, we learn a little bit, but not a ton. Then reading about the effects on performance. Not so much research on effects of strength training on injury prevention yet in runners, but for performance can definitely enhance that. And yeah, so it was just kind of started combining the things that I had learned along the way.
Now you mentioned like heavy squats and heavy deadlifts. I know that kind of goes against what kind of some people would think, at least kind of uh, conventional wisdom, so to speak. Even though the pendulum is swinging, seems to be more in that direction of kind of low reps and heavier for endurance athletes. So can you talk a little about kind of how you came to the realization or kind of your thought process on kind of keeping that as part of your routine as you transition back into kind of more running focused?
Yeah, I think initially it was just because of it happened to be that I ran really fast when I was
Mhm.
doing that. And then looking at the research too, for performance, that actually does make a bigger difference. So I think combined with what I've learned and then my own experience, that's what I ended up doing. And then it can be really tricky to kind of work it into your running training though. So I've learned a lot from Chris Johnson, of Zarin PT, about kind of the timing of strength and that kind of thing. But as far as like specifics, I would do like twice a week. It'd be non-workout days or at least 3 hours after a run.
Mhm.
And then just pick a couple heavy things, either like a trap bar deadlift, um, or a barbell deadlift, front squats, and then like another type of squat on a different day, like a rear foot elevated split squat. 3 sets of 6 to 8 at like 80% or above of my max, which I just kind of, it's hard to actually specify those.
Yeah.
So I just kind of go by effort, like use an RPE scale, perceived exertion on that too. Um, and it's hard to say over the past several years how much that's helped, as far as performance, because I haven't been racing consistently, but it does make me feel good. And I think for females especially, it can just help with feeling like strong and robust. I know I talked to a lot of females who just feel better when they're lifting. I don't know if you've had that
Oh yeah,
experience.
absolutely.
Yeah. Do you find, I don't work with a ton of males, but do you find that in males as well?
Not so much with males. I mean, males, it's like the old saying. It's like the women need to train like men, and the men need to train like women.
Uh,
The women need to be headed to the powerlifting gym, and the men need to be headed off to yoga class. Or,
right, a little bit more like
yeah,
just different needs based on how we're structured. So
yeah.
um
But yeah,
yeah, go ahead.
yeah. I just just to echo with what you're saying about the on the women's reactions. It's just the there's almost this like epiphany, like this light bulb just goes off the first time, whether it's regardless of what the exercise with, but anything, what their definition of heavy would be, for them to pick something up and realize like, oh wow, I just did that.
Yeah.
And it does so much for, I mean, regardless of running. I mean, for the general population, for runners, whatever. I mean, it can be very transformative.
Absolutely. Yeah. And then if we just think about longevity in the sport and even just quality of life, like, especially, I mean, we know weight training also improves bone density, which is something that I need. Lots of, I mean, Caucasian females are at greater risk of osteopenia and
Mhm.
osteoporosis. So that's helpful too. And then as we get older, we lose muscle mass. So I think just knowing how to lift and move is important for our longevity, not only in the sport, but just in life.
Now, what about, do you get this a lot? The old, well, I just don't want, I'm a runner, I don't want to get bulky. I mean, how do you,
Mm,
what's your kind of go-to explanation to educate people on that?
yeah, that's a good question. I mean, just straight up, you won't.
Uh-huh.
Like, that's been um, disproven a lot, and it the reps that we're doing. I mean, there you can talk people through the endurance, the hypertrophy, the strength phases, but um, if we're running a certain amount per week and we're not bulking, eating, an excessive amount, which I have other thoughts on that too, because I don't think a lot of females eat enough.
Yeah.
But just, straight up, you're not going to get bulky. That's, if that happens, we will address it at that point.
Uh-huh.
But it's very, very unlikely. It's really more about improving your muscles' ability to generate force and generate power. And that's not necessarily going to make you bigger. Um, and I think as people do lift, and again, it's been challenging. So a lot of times I'll have people do body weight stuff and we actually have to up it. It's not the heavyweight lower reps that we want at this point
Mhm.
during COVID, but we're still able to create a stimulus. But I think people see that over several months, they don't get bulky, they feel better. Like you said, there's that light bulb. And so it just kind of counteracts any hesitancy they had toward lifting in the first place.
Yeah, yeah. And one of the things that, it's hard that I try to explain to people too. It's like there are people who work really, really, like how much work it takes to actually bulk. Like people who are where that's their thing, like people who are in that business of trying to get bigger.
Right.
It's a lot of work, and
Yeah.
it's
For years, right?
yeah,
It's not like
yeah.
a
So
few
yeah, so
months.
someone running 30, 40, 50, even more miles a week, just hitting the gym twice a week, you're not gonna blow up like a bodybuilder.
Right. Absolutely. Yeah. That's a really good point too. They, they do work very hard to do that.
So so we talked a little about the strength side of cross training and supporting running, and you had mentioned you did a bunch of swimming in school as your cross training.
Mhm.
So what's been your experience and some of your thoughts on different modes of cross training, mainly in the that rehab period, but also if we can talk like to supplement your mileage too.
Yeah, definitely. Yeah. So definitely varies with rehab versus in general. So right now with another stress fracture, I am swimming because with bone, you need to offload it. It's not like other certain injuries where you can maybe work at a low level of pain. With bone, you just have to offload it. So I've been swimming or doing stuff in the pool. And I'll gradually get back into biking, but only with the purpose of basically gradually reloading the bone. I don't typically cross train with biking or anything when I am in the midst of a training cycle. That may be something we play around with just because of my history of bone stress injuries. So I'm not saying that biking or different modes of working out aren't helpful for some people, but when the goal is to be running, your best cross training is going to be walking. If we want to expose ourselves to the joint forces that are most similar to running, then walking is going to be the thing. That discounts and takes out. People ask about elliptical all the time. I don't think the elliptical is helpful. It's not exposing your body to the same forces that you're going to get when you're running. Now, again, if it's all you have and you're still in a point where you're like starting to load a bone, then maybe. But I would rather my people be biking and then gradually doing like a fast walk program to return to run. And I'm biased because I spent hours on the elliptical like thinking that that was going to help me get back to running. So I also just may have this, dread of the elliptical. But I think it's overutilized and it doesn't really do what we think that it's doing. Let's see. So yeah, I think I covered like for rehab from a bone injury, I usually have people progress from non-weight bearing to light weight bearing, making sure they're able to walk, into fast walking, make sure they're able to hop without pain, and then get back to running. Mm-hmm. So we can kind of recreate those forces that they're going to be exposed to. For people who are just more like they only want to run a couple times a week, then yeah, totally work in the biking. If you like elliptical, sure, but it's not going to be the biggest bang for your buck. I'd rather people spend 30 minutes strength training than 30 minutes on the elliptical. From a perspective of if you do have a susceptibility towards injuries or bone stress injuries, for me, maybe I do work into the pool into my schedule once a week from now on, just to vary forces on my body. But I also want to bring up the Alter G. So those of you who don't know, the Alter G is like an anti-gravity treadmill. You put this little belt on, you strap yourself in, and it blows up, and then it decreases the amount of weight that you're running on. So you can set it so you can basically only run with like 40% of your body weight, and you're just flying, right? And they had one of those at Arizona State, and I used it constantly. It'd be like the thing that I would do to still feel like I was running when I wasn't actually able to run. And I think that it can be useful for certain populations again, but I think that's overused as well. And again, doesn't expose you to what you're actually going to need when you're running. Even using that, I bounce back and forth from one stress fracture to another, So I think if you're having trouble, like getting back into regular walking without pain, that could be beneficial to go from 50% of your body weight to 75 to 100%. But it also, the way it straps you in can change your mechanics a little bit. So I would just make sure you talk to someone knowledgeable before just jumping on that and using that to get back to regular running. And then supplementing your running with that, again, if you have access to it, maybe that's cool for free. But I think fast walking is going to be the best bang for your buck again, because we're just, by using the anti-gravity treadmill, we're just taking some of the forces and the stressors that actually would help you adapt, we're taking that off. So to sum it up, I think just looking at the intention and the purpose and like, am I doing what I think that I'm doing when you're going to engage in any of these other activities?
Yeah. And so with the Alter G, I think one thing that I've found with people, I mean, not that Alter Gs are all over the place or anything, but it's that people almost like turn their brain off. It's like, okay, I'm hurt, here's the Alter G, go train on it, and don't really address the underlying issues that so you mentioned like Alter G altering mechanics, but maybe there is something mechanical or strength or flexibility based that predisposed the injury, and it's the Alter G is kind of this crutch in a sense to kind of avoid what needs to be dealt with.
Absolutely. Yeah. And I think for many people who get bone stress injuries, one of the biggest fears of any injury, right, is losing fitness. And so it's like, oh, well, at least I can use the Alter G and keep my fitness up. And that just can't be your goal when you're dealing with a bone stress injury. You're not going to heal as well as you could if you just took a little bit of downtime, So.
Yeah. And with, so how do you deal with when people, you lay out, okay, we're just going to focus on strength for now. Like, how do you educate people with, I got to kind of desperately cling to this fitness that I have. Yeah, how do you work through those conversations of, can I at least, sit on the bike for 30 minutes or whatever? And you hear
Mhm.
stories of some elites over the years doing like these epic pool sessions and stuff like that, aqua
Yeah.
jogging.
Yeah, and it's heartbreaking. Like if you even suspect a stress fracture with an athlete, you like it's scary to tell them even that you're suspecting it, because you know what that means, even if they don't quite know, and it means you're gonna have to shut them down for a little bit, and that is just heartbreaking. But for me, I can go back to my experiences, I guess. And granted, I didn't have the healthiest bones, but each time I did that and I tried to stay healthy, it would just delay it. It's like, okay, you can either go all in and not just accept, because I think there's a grieving process and that's okay. But you can either go all in. Now, this is your training plan where you're going to do only things in the water for 4 weeks. Or you can kind of, half-ass it. Sorry, half do it. Is this okay in this group? Or you can do 50%, and it could be 8 weeks before we're actually getting back. So that little bit of fitness, not little bit, because you worked really hard to get there. If you're clinging to that as, a piece of your value as a human, then, and that forces you to avoid the downtime and just keep trying to push through, it's going to take twice as long for us to get back to where we want to be. And, asking people why they're in it in the first place, because I think we get really caught up, and COVID maybe has helped with this. We get really caught up in the numbers and the times and putting value in our own self-worth on how fast we can run and what place we get. When that's taken away, ultimately it comes back to like, why am I even doing this? And the more you get injured, the more you ask yourself that, right? And for me now, it's about the process, and I learn something every single time. And yeah, I want to get faster, and yeah, I want to qualify. But if I don't, like, if I knew in the future that I wasn't going to qualify, would that mean that I'd stop trying right now? And that my answer is no, I'm still going to try, but in the past it may have been different. And if your answer is no, you still don't want to do it, or you don't want to do it because the outcome might be different, then maybe you need to take a different approach to look again at why you're doing the things that you're doing. Because I think if we get too focused on the outcome, and then something like this happens and the outcome is not even a possibility, we don't even know when the next races are going to happen, right? Then it's like you really have to reflect on why you're doing what you're doing. And when you can enjoy that process and just the act of pushing your body and seeing where your limits are, and sometimes you hit those limits, and that's okay. But enjoying that act, and really anything in your life, it's just going to make everything a lot smoother.
When do you think you made that, kind of cross that threshold of being able to have that acceptance of, whether it's personal identity or whether it's kind of your why of doing it for, self satisfaction versus trophies? When did you feel like you crossed that threshold?
I don't think it was until I tore the labrum in my left hip and started coming back from that. So 10 stress fractures later and a torn labrum. That one was actually a lot rougher than a stress fracture for me because, bones are generally going to heal over 8 to 12 weeks. And I didn't know what to expect with the labral tear. And so coming back from that and racing again, thinking that I was maybe never going to be able to race at a certain level again. I think that once I had my first race back, that was more transformative. Like, all right, wow, look at what my body's accomplished. And I've worked this hard over the past several months. And there's still that thought of like, wow, I'm not as fast as I used to be. But it had less control over my experience. Does that make
sense? Yeah, absolutely. So one point that I just thought of that might be helpful for you to elaborate on is, so having had all these different stress fractures or stress reactions, what are some of the signs that you noticed that might be able to help people distinguish between like the shin's obviously a popular place
Mhm.
of, do I have shin splints, or should I really be worried about the stress fracture? I mean, what are some of the kind of, big picture signs that you've noticed personally and professionally, of course?
Yeah. Yeah, absolutely. So if you're having pain that's just not going away, over weeks at a time, and it's getting worse, seems to be worse with activity, especially impact, and then progresses generally to night pain. Night pain is a huge red flag. If you're not able to sleep and you're resorting to medication to sleep, you need to see a healthcare practitioner. And I would actually recommend seeing a physical therapist over an MD first. We have direct access here, so you can. Your insurance, or some people are cash based, obviously, but your insurance may or may not cover all of it. But legally, you can go to a physical therapist first, and that's what I tell people. They're going to be way more knowledgeable about this sort of injury and where to send you from there. And they can really help differentiate that, because with stress fractures, it's imperative that you get an image. But some things can present like that, and it's, I wouldn't say like wasteful, but you may not even need an image. Imaging is over ordered in most cases. So if your physical therapist watching and you suspect a stress fracture, then definitely get them an image. And that X-rays generally won't show it for 6 to 8 weeks. So if like, have a good connection with an MD or a DO who can order the right image for you. I actually had a misdiagnosed stress fracture this year. So I'd say for physical therapists, if in doubt, order it. Pinpoint tenderness, night pain, something that just doesn't feel right. Like, you're like, okay, for runners, it's generally going to be like a tendon or a bone. Like, we don't, for these running related injuries, those are going to be the most common, or like patellofemoral pain, which you don't need imaging for either. But so I'd say, when in doubt, as a PT, get an image, know someone you can refer to get that image relatively quickly. And if you don't have good insurance, like me, you can just pay cash for MRIs, and it's so much cheaper. So if people are hesitant because of their insurance not covering it, you just call and ask for their cash rates, and that can be a really easy way to go about it. As a runner, if it's going on for a long time, if you're starting to have night pain, if you're not able to get through your daily activities without pain, those are some big red flags.
And then we also have, some diagnostic tests in our toolkit of varying levels of sensitivity and specificity.
Right. Yeah.
But yeah, so people watching, I know the image is, it is the gold standard, but bottom line is, if you're hurt, if it does, sometimes to the extent it doesn't even matter what label we put on it. If it hurts to run, then
Exactly.
At some point there does need to be a backing off process to it.
Exactly. And even like, if you're like hearing this and you're not sure, like, you may not have to shut it down. I've heard of people who are like, oh, it hurts, and I was scared and I just stopped, and it turned out it might be a tendon and something they could have run through. So yeah, bottom line, just seek help, and know that a physical therapist is going to be, and even a physical therapist knowledgeable in running, right? Like, I have colleagues who are less interested in runners, unfortunately, and they haven't read the research as much, they don't know as much. So if you've tried physical therapy and it didn't go well, know that there are other PTs that will know more about what the demands of running are and what you need, and reach out to us, to Alan or me, and we can help you find someone in your area. But I agree, like, even if you don't think it's a stress fracture, get help, because you might be able to work through it while running. Like, I just worked with a guy with Achilles tendinopathy, and we just changed the load a little bit, changed his strength training plan, and he was able to keep running. Like, we didn't have to take, even more than a few days off. So just getting the right diagnosis can be really important.
Yeah. So you mentioned, some of the patients you're working with. Can you talk about, like, kind of how you operate as a cash-based practitioner? What that allows you to do in terms of blending the the coaching and the running to create this this synergistic process that you're able to practice at a much higher level than if you're constrained by certain institutional restrictions.
Certain institutional restrictions, yes. I'll call it out. No, Cigna is the worst. But yeah, it's been awesome because like there's this gap between quote physical therapy, right? Like, okay, I go in and I'm really in pain and now I'm better. Do I just go back and run? Do I go back to my, off the shelf training program that got me hurt in the first place? Like, how do I navigate this water? And being a coach and a PT, and especially cash-based, is so great because you can go, like, just an example, I worked with a girl who was having hip pain, and it didn't seem like a stress fracture. It seemed more like tendinous. So we did a PT session. I gave her some exercises, gave her a week. She was 100% pain-free after a week. It's like, all right, you can be a coaching client now. Otherwise, like, maybe we do another couple PT sessions, but she didn't need to be medicalized. There's nothing wrong with her. And so she needs a smart training plan to get to what she wants to do. So that just allows there to be a lot more congruency between that rehab and then her training as she gets faster and is able to run further and longer. And the congruency is huge. The communication is such a huge piece of what we do as coaches and physical therapists. And through the coaching, I have an app and I can basically keep track of people. So it keeps them accountable to what we've planned for their training. And they can also just make a note in there and I know their history. And it's like, oh, my hip was acting up a little today. So I just go in there, maybe change something down through the week. We do a little bit less speed work. We put a little extra strength training in there and they're good to go. So I think it just makes things, a lot more autonomous for both the athlete and myself. We're not held to a certain amount of time, a certain number of sessions, because the body doesn't respond to that. It's not like, oh, you only need 6 sessions for this, because that's like, they don't even use healing timelines. Sometimes it's within a 30-day window. It's just this stuff that like someone who's not in healthcare made up. So and I could just talk about this and be on my pedestal for a while, but the ability to meet people where they're at and see them through their whole journey is the biggest advantage to not working with insurance companies. And then I think as a physical therapist, we have advantages that some other coaches who are great coaches because they've been in it longer, they're experienced, they've worked with a ton of great athletes. But I guess as a newer coach, I have advantages from that aspect of knowing the body, knowing anatomy and physiology, knowing the healing timelines and what certain tissues respond to that a typical coach may not. And so I even work as like a running consultant for a triathlon coach. Basically, when it comes to the running portion, if someone's having an issue, I just chime in, and it's a really great team for the triathletes.
When exactly did you get involved in the coaching side?
That was prior to starting my own business. It wasn't really even my idea. And initially, I went to the University of Michigan for my residency, and just was really into running stuff there too. And my residency director reached out to me after I moved back here and was like, hey, my friend is starting to run ultras. Can you advise him? He has no idea what he's doing. So he and I just started emailing back and forth, and I would give advice. And he was like, I'd really like to make this more formal. Can I pay you to help me out on a more consistent basis? And that's kind of where it started. So from there, and then seeing my own physical therapist who helped me with my hip issue, seeing her being a coach, and she became my coach, it was like, oh, this is something that I could do for more people. And so after starting to work with, his name was Chris, I actually just reached out to a couple friends I know who are runners, and I was like, hey, can I coach you for free for a couple months and just kind of get my feet wet? And now, it's just expanded. So
how is, and you alluded to this a little bit, but how has your PT education shaped kind of your coaching philosophy in a way different than the way a lot of post-collegiate runners coach? It's like, I'm just going to do what my college coach did and just sanitize it for people who aren't quite as talented.
Right. Yeah. I think it's helped in the aspect of when to push and when to back off. Knowing that there are some tissues that don't respond well to certain things, like, an irritated Achilles. We're going to back off on hills this week. We're going to back off on speed work versus pushing through some of these things. And having the experience of a labral tear and knowing how that responds as well. Or things that we can actually push through. Like, okay, this, in my experience, this actually gets better as we keep going. And so I think it just helps with assuring runners that what they're doing is okay. And with the hardest decision we all have, right? It's like we either back off or we keep going. And, our type A personalities, most of the time, we're going to try to push through a lot of these things. And so I think having someone who has a background in the medical field, has a background in running, and has had their own injuries just helps people trust that they're doing the right thing and they're making the right decision. And most of the time, I'm not even making the decision, right? I'm just someone who's like, do you think that's a good idea? and they can really start to tease it out for themselves. Because people are more convinced by what they hear themselves say than what by other people say, So if we can help them come to their own conclusions, but, it might take a little more hand holding initially, but eventually help them come to their own conclusions. I think that's the biggest skill that we have in helping them feel empowered.
Yeah, absolutely. I think that's one thing I've learned is a lot of the best coaches just ask questions and then the athletes answer it themselves.
Yeah. And it can be tough because we come out of school with guns a-blazing, like, oh, I know all this and this attaches here and it's probably happening because of this. And ultimately, we have to kind of swallow that stuff may not be as necessary or useful as we had hoped. And that can be a tough pill to swallow, but that's really what it's about is empowering them and what's going to be the best thing for them. And typically it's not all these, Latin words and attachment sites and all that, which is still important to know, but we don't necessarily have to be telling people everything that we know for them to do well.
Yeah, absolutely. So with shifting back to your own running career, you've had, as we've gone through this all, you've gone through the whole spectrum of experiences that most people haven't gone through, having been pretty much elite, one of the best in the country at what you did in high school, and then still pretty good running at a very high level in college. So essentially the elite level domestically, but then going all the way down to really just running for just to run, and then now back to where you are being a post-competitive or post-collegiate competitive runner. I mean, is there anything that really ties all those experiences together that you really take from that?
Oof, that's a good question. I think just the overall passion and love for the sport. And I used to think it was this, for a while I wondered if I only liked it because I was good at it. And so not necessarily, I guess when I say the sport, I just mean running in general. Not necessarily racing. I used to not be able to understand why people ran and didn't race. So I do still have that competitive aspect to it, but if that's all that I had and focused on, then I wouldn't still be running, because there was a time where I'd sign up for races and pretty much every time before a race I'd get injured. I'd overtrain leading up to it, and then a week before something would go wrong. So I think it's just the the way you feel after you complete a run, the way that it makes you like experience your body pushing to the utmost limits, or even beyond that, or maybe even more important than that, is kind of the relationships you can establish with other runners. You know, those easy runs where you just talk to someone for the entire time and you're running both slower, but it's just a fun experience and you get to see the world. And so I think with all of those highs and lows performance wise, my appreciation and love for it has changed from being something that was like, this is what I am and what I'm good at, and this is my identity. But I might love it more now, to be honest, than I did when I was really good. But just that the feeling you get from it, that's pretty indescribable. And that I don't think it's gone away.
Yeah, it sounds like it hasn't. If you're looking for looking toward trials in 2024.
Yeah.
So do you have a plan mapped out for that?
I just got to get consistent again. Yeah, it's probably honestly a good thing that there aren't any races this year. I'm sure that it'll be canceled. I was going to do CIM, but now it's just going to be easing back into it. And I think emphasizing the things that I always preach to other people, like sleep, nutrition, stress, emphasizing those things that like the recovery aspect that actually leads to improvement, not just the stressor component of the workouts. That part I've got down. It's going to be the recovery that I really have to emphasize to get where I want to go, because consistency is one of the biggest things in improving performance. You know, if you're running for 4 months and then you have to take 2 months off and you come right back up, your performance is going to differ drastically than if you had just been running even at a lower level for that entire, what would that be, 8 months or whatever time I said. So consistency and recovery are going to be the focus. Focuses.
Yeah, foci. Yeah, focus.
There you go.
So so that was all great information. Is there anything else that we didn't cover?
No, I feel like I talked a lot. Some water.
No, it was great information. Now there's one question. So I don't know if you caught Megan's interview yesterday, but there's one final question that I will ask. It's so you have a 4x1 mile relay, and it can be for fun, or it could be to set a world record. You're on the relay. You have to be on the relay. So who else are you picking to run with you?
4x1 mile. I'm gonna choose. Okay, or for fun. I was like, okay, we don't need to win. I'm gonna choose Opsi Peru. She and I ran together in high school, and she's out here in Phoenix now, and she ran at the trials this year, and she's just an awesome human. I'm gonna choose. I'll bring my coach in there, Renee Hodges, and then, oh gosh, one more. Oh, my friend Corinne. She and I ran together in college too, and she's awesome. So got those three. It's more we're like all, I think, the same level of enjoying running, and it wouldn't be too competitive, but it'd be a good team.
Yeah, you're definitely not going to finish last, it sounds like. Where are you going to put yourself on this team? Are you going to?
I'll be the anchor.
Yeah. Anchor. I like that. Want the ball when it counts.
Yep, exactly. Great question.
All right, so so thanks again for joining us. Why don't you tell everyone where they can reach you, both online and in person, because I know there are several Arizona people on here.
Yeah, awesome. Yeah, so I'm on Tatum and Shea in Scottsdale, Phoenix area. And in online, I'm on Instagram quite a bit. It's my business called Volante PT and Performance. So it's at Volante _PT, VOLANTE. And Facebook, I'm more active just on my account, Stephanie Mundt. Mundt is my last name. And it'll be tagged in here, I'm sure. And then I think that's pretty much it. You can just reach out through either of those, and we can hop on a call. I'm happy to talk about any advice for bone stress injuries or labral tears. I didn't have surgery for mine. I did treat it conservatively. So it was a process, but definitely worth it. I'm definitely an advocate for conservative treatment of hip labral injuries. Yeah, or even disordered eating. If you know anyone who's struggling with that, I'm happy to chat about that as well, just as someone who's been through it.
Yeah, awesome. Yeah, that's extremely helpful. So I'll let you go now, and thank you again for all the great information.
Yeah, thanks for having me.